Our main goal of colonoscopy is to look for polyps. Polyps are how colon cancer gets started. Over time, usually years, they slowly grow in a silent fashion, so most people are not aware they have them, and then they can develop into cancer. There's differences in polyps. Not all polyps are precancerous, and some polyps are even cancerous. Sometimes you can tell by looking at them, their shape, their size. By removing them, we interrupt the sequence of events that lead to cancer, and then they're all analyzed under the microscope to make certain they're not something serious and whether they are precancerous or not. If they are precancerous, it means that you have to be monitored on a more close schedule than if you didn't have polyps. About 1 in 5 people will have polyps over the age of 50, and they don't know it, and that's why we start usually at the age of 50 or younger if it runs in their family. Common things we see is diverticular disease, which in the United States is very common because of our diet, which is low in fiber. We also see little leaky blood vessels. Those are called angiodysplasia as people get older, and those can be a source of bleeding or blood loss. Sometimes inflammation. People can have Crohn's disease or ulcerative colitis, or an infection, for instance, salmonella. Our goal is to do as much as we can while we're there, and that may be simply be taking biopsies. It may be the removal of a polyp, and it may be the destruction of a leaky blood vessel with electrocautery. Colonoscopy consists of placing a thin tube, an endoscope, into the rectum and getting a complete exam of their entire colon. It takes about 15 minutes. And it's done under anesthesia or conscious sedation. People have no recollection that time has elapsed, and they certainly don't have any pain. People wake up quickly. They usually feel very good, maybe a little drowsy or a little gassy, but most people feel good. And within hours, they're back to their normal routine, minus driving that day. So it's a very short-lived experience. The interference with daily activities is really limited. What scares people the most is, I believe, the risk of complications. And the complications are very rare, like a puncture or bleeding, aspiration, or missing something. Those are the major risks, and they pale in comparison to the risk that you'll take if you don't have the procedure done, because colon cancer is so common. One of the most difficult things about what I do is to take care of people who have cancers and don't realize that that's been there for years. That's the sneaky part of colon cancer. You can have it for 5 to 10 years and feel fine. And I think that's one of the biggest hurdles that patients have to overcome, is to realize the time to come to me is when they feel well, not wait until they get sick.